We have some really great tips from someone who knows, a surgeon, who wants you to learn what every patient should know. As many as 98,000 Americans die every year from medical errors. Hospital infections among the top 10 leading causes of death in the United States. Just this week, we heard about another major medical mistake, a tragic one, a man who had the wrong testicle removed during an important surgery. So how can you make sure you don't become the victim of a medical error? Dr. Atul Gawande is the author of the book Better, A Surgeon's Notes on Performance, Lessons He's Learned, the Inside Story, and it's good to have you with us, Dr. Gawande.
It's great to be on.
All right. You say it starts with simple things, really simple things. Hand washing, number one.
Well, part of what we need to understand is what's the difference between just being competent at what we do and really being great at what we do. And it's not genius. It's people who understand their fallibility and the fallibility of our system around us. And so we come to something like hand washing, which seems utterly mundane.
And you say, we the patients must say, wash your hands. Did you wash your hands? We have to take an active approach to this.
It can help. It can help. There are 2 million infections that patients will walk out of a hospital with each year. And the biggest difference is just attention to detail that everybody has to have. That means we had to switch from understanding that, nurses weren't being lazy. They have 4 patients all ringing their call button. They want to help everyone. Sure. You put an alcohol dispenser instead of having to wash your hand for a minute.
So they can do it the minute they hit the door.
Be able to do that. Exactly.
Another thing, look out for, the yellow sticker. The yellow sticker, this is it. You're in the hospital. You see this on a door of a nearby patient. What does it say to you?
What this means is that there is someone who's been identified with an infection that they really have to make sure doesn't spread to anybody else. It means that everybody has to wear gloves and gowns. And it means that you as a patient also should think about having your own family washing their hands, especially if that's on your own door.
If you're in the neighborhood. But it scares you to death. Should you say, I want to move. I don't want to be near that door.
No, it could be as simple as a flu that somebody has. It's going to be there on different floors wherever you go in a hospital. But this is why the places that are really great at what they do are able to pay attention to the details.
Okay, another thing you raised, I confess I had never even thought about this. You said that people don't realize that you've got to have your medications on a list with you wherever you go at all times. Don't have to recite them again because you might leave out something critical.
Yeah, part of the orientation that I try to get people to understand is why do things fail? And when you just go to see a doctor, the most common way we make a mistake is getting the medications wrong. If you bring your medications, if you're going into a hospital or going to see a doctor, bring them all, even the non-prescription medications, because that way we're clear. What are you really taking and what should you be on and not be on?
Now, we heard about the tragic case of the man who had the wrong testicle removed, and for a while everybody in the country thought the answer was a magic marker, right? This side, this side. Is that still an answer? And tell us about this first line on the consent form, which you say it should be the headline that you examine before you go into surgery.
Yeah, we still have to mark and make sure that we, before you go to an operating room, that we've signed our site. The second thing, though, I think patients can really help. You get this 4-page consent form. This is the one
like
from my own hospital. And it's got all kinds of details, and you don't know where to look. I'll tell you the single most important place on here is that very first line. Is it the correct side, left, right? And then also, I say adrenalectomy here. Well, do you know what this is? Are you sure? And if you are at all confused about what it is that you're getting, you're allowed to ask.
Read it. It's a fail-safe on surgery and the right kind of surgery. Now, we have a sponge here, which I mentioned before, which has a barcode on it, like the kind you have when you check out at the grocery store. You now count these? You now double-check to make sure nothing's left inside a patient?
Well, when I thought about the lessons of the book, I wanted to think, how would I just apply it to a problem that I see around us? And I thought, well, sometimes we do leave sponges inside people. I've seen the cases myself. It seems like must be just carelessness and negligence. Instead, what I found studying them is that there are situations where the counting system breaks down. We always count everything at the beginning and everything at the end. So we came up with a really simple idea. If you put a barcode on a sponge and use a supermarket scanner, you can see at the beginning and end what happens.
An ingenious idea. Anyway, the book is amazing, and for anyone going into surgery, it is really a way to double check and prevent some of these errors. And one of them, which is in the book you'll want to read about, which is don't leave a patient alone. Doctors need you there, need family there to help double check too. It's called Better. It's Dr. Atul Gawande, and it's so nice to have you here.
It's great to be
really
here.
Great to meet you.